Hi, I'm Dr. Brian Quedman. I've been doing laparoscopic bariatric surgery for almost 30 years. I started doing the laparoscopic gastric band in 2001, and I've seen literally thousands of patients come into my clinic looking for a lap band adjustment. When somebody comes into my clinic and says they need the band adjusted, and they haven't had an x-ray test confirming that the band is in good position and that everything is fine with their esophagus and stomach, I always insist that they get an x-ray test first before I do a lap band adjustment. Some of the time I get resistance, and some of the time the patient leaves angrily saying that they don't want the x-ray test, they just want an adjustment. They know it's not working because they're able to eat. Well, here's an example of one patient that came in and was able to eat too much, felt that I needed to tighten the lap band, and was a little bit resistant to me doing an x-ray test. But when we did the x-ray test, we found something very interesting. The first image shows a normal size esophagus. The esophagus is generally about the diameter of your thumb, for example, and it runs down your chest from your throat down to about the level of your upper abdomen or the lower part of your sternum. When you do an x-ray test, you can see the diameter of the esophagus and tell whether it's normal or not. On this particular patient, we did the x-ray, and it turned out that the lap band that was getting adjusted for this patient was actually too tight. As a result of the lap band being tight for quite a while, the patient lost the sensation of food going slowly through the esophagus and slowly through the band. In fact, the food backed up into this upper stomach and backed up into the esophagus. Over time, when this happens, oftentimes people will lose the sensation of food staying in the esophagus. Generally, this would be uncomfortable, but over time, if it occurs slowly, the feeling of discomfort doesn't occur. This particular patient, and I've seen many patients like this, ends up with the esophagus dilated and food retention in the esophagus, or food staying in the esophagus that should be passing down. The patient then eats and stops eating when they feel like it, but all they're doing is filling up the esophagus to a dangerous level. The esophagus can actually rupture, but more often than that, the patient gets asthma, which is actually reflux of contents up the esophagus and aspiration of those contents into their lungs, causing them to cough or wheeze. This kind of asthma is very dangerous because it indicates that the patient has a high risk for reflux, nocturnal reflux, and possibly aspiration and pneumonia, and that could kill them. So in that particular patient, when I did the x-ray test, which you see here, the esophagus was massively dilated. In fact, it was what we call a sigmoid esophagus or a tortuous esophagus, meaning it angles back and forth on its way from the stomach up to the back of your throat. And you can see here that the esophagus is markedly abnormal, angled back and forth. And this patient came in because he wanted the lap band tightened up. Instead of that, I recommended that he have the lap band removed immediately. His esophagus was so dilated and the food was backing up that it was actually a dangerous operation in the sense of him aspirating. And I let all the fluid out of his gastric band that allowed most of the contents of the esophagus to go downward. Of course, the lap band at that time wasn't functional at all, but it needed to come out because his esophagus needed to recover, and probably at this stage will never recover fully. So whoever was doing his lap band adjustment and tightening it and tightening it and tightening it was causing this person to have permanent damage to their esophagus. The end story for this patient is that we released it, we safely did the anesthesia, safely removed the lap band that day, and apparently he's done well since, although I don't know if he's gaining weight or losing weight, but he's not aspirating and he's not storing food in his esophagus any longer. I've actually seen this probably close to 100 times over the last 20 years. So if you're having lap band adjustments at this point and you haven't had an x-ray for a long time, for this reason as well as others that I'm going to show on YouTube, you need to have an x-ray test. The x-ray test is called an upper GI test, and we have you drink contrast. It goes down, and it gives you pictures of the inside of the esophagus, the upper stomach, and tells us whether the band is in the correct place or not. Okay, I hope you got some information from this. If anybody's having a problem like this, you're welcome to give me a call, and I can discuss it with you over a consultation. I do not put in lap bands anymore, but I think the procedure was pretty good if it was managed correctly. However, too many times it's not. Okay, have a great day. I'm Brian Quedman, bariatric surgeon, Newport Beach, California. See you later.